And as a doctor, as an emergency medicine specialist, I know how to read papers. I know how to take out inferences out of them. I've been practicing emergency medicine for about 17, 18 years now. I mean, I've been working out. I've been eating everything like people used to tell me. My fitness trainers used to tell me that you work out so much, eat whatever you like, have your 4,000, 5,000 calories a day. A lot of people have alcohol. There are very few people who have alcohol every day. The ones
Right.
who drink every day obviously will end up with alcoholic liver disease. A lot of doctors are vegetarians. A lot of them.
Emergency medicine specialist, guiding people through preventive health. Our guest today on the Settle or Be Better podcast is Dr. Ankur Verma, who's going to be talking to us about carnivore nutrition and how not to end up in the emergency room. So, welcome, Dr. Ankur, and over to you. Why don't you begin by telling us a little bit about your personal health and well-being story and your current work?
Yeah, thank you so much, Sakshi, for having me on the Settle or Be Better podcast. The name makes so much of sense. I mean, do you really want to settle down with what you have and what you don't have, or do you really want to get better? Right. So I'm an emergency medicine specialist, like you've already told the guests. I've been practicing emergency medicine for about 17, 18 years now, and I've been working out for about 23 years. But in 2021, I got a reality check for myself when I found out my triglycerides were around 600 or 650. And I was like, there is something wrong. I mean, I've been working out, I've been eating everything like people used to tell me. My fitness trainers used to tell me that you work out so much, eat whatever you like, have your 4,000, 5,000 calories a day. But then I realized that I've never been trained in nutrition. And it's not just me. None of the doctors are trained in nutrition. We don't go through nutrition training in our medical school, even forget about post-graduation. And then I started going into my nutrition journey. Not that I'm not a fitness guru. I'm not a trained nutritionist, as a disclaimer, but I've done my research. I've been through a lot of papers. I've heard a lot of stuff. And as a doctor, as an emergency medicine specialist, I know how to read papers. I know how to take out inferences out of them. So yeah. So I mean, my first step was keto, obviously. So I went really low carb, and it was easy for me because I've always been an omnivore, but always leaned more towards my non-vegetarian food. I mean, my parents tell me since from the age of 2, I used to make sounds of chickens and probably fish, sign language that I want to eat, all of that. And then obviously down the line, junk food happened, and we were eating everything. So I cut down all my sugars, I cut down all my processed foods, and in about 8 to 9 months, I lost 21 kgs. So from 86, I went down to 65 in 9 months. That was 2022, about Jan or Feb. And since then, I've maintained the weight. So I've never bounced back. I figured that I did not have a carbohydrate addiction because I never had cravings. So that was a good thing. But then again, my research took me more towards a carnivore diet. And, and then I started looking at my patients. I mean, we were always looking at who to give what medicines, but none of the doctors actually look at the root cause analysis. I might be wrong. There might be some doctors out there. No offense to any of the doctors, but, nobody looks at the root cause analysis. Nobody understands that our mitochondria, which gives us life, is actually affected by the foods that we put into our body. And when I started looking at all my patients, no matter what age they were, 20, 25, 18, 60 years old, 90-year-old, they would come in with either complications of the diseases that they have, which are mostly the non-communicable diseases, the metabolic syndromes, or complications of the medications that they've been on. And every one of them would be saying that we eat a healthy diet. I've started asking them for the past 6 or 7 months, what do you eat? And most of them are vegetarians. And as you know, the standard Indian diet is a carbohydrate heavy diet, be it South India, be it North India, be it West, East. There are only a few states probably in India which love their meats, but they're still, again, supported by a lot of carbohydrates. So you have like a lot of rice, you have a lot of rotis, breads, all of that, and not too many people eat their meats every day. So it's mostly vegetarian stuff. So there is definitely a link in our diets in India, and that's why we have so many non-communicable diseases, diabetes, hypertension, cancers. In my hospital, we have a lot of cancer patients coming in with complications, and they're all vegetarians. Then you have PCOD, you have fatty livers, all of that. So I then moved on to carnivore, and I've never felt better. So I'm almost 1 year down doing only a carnivore diet. And I would say I'm a 98% carnivore. I like my fruits sometimes, probably raw milk once in a while. But all my meals, and it's usually 2 meals a day, sometimes 1 meal a day. And it's all carnivore. So that's my journey. And I'm trying to educate people, as a doctor. Yeah, I mean, I can only advise. I can never, make people do what I would like them to do. That's up to
Right.
them. It's my job to put out the information. That's what the problem is. People have been misinformed for many, many years. Even us as doctors have been misinformed many, many years, and we've passed on that misinformation to all our patients. It's time that I try and reverse that and give them the correct knowledge through a lot of research and through my experiences. I keep checking my profiles every 6 months, and everything is absolutely tip top. And so people can then make an educated choice and decision as to what they want to eat, what they want to do with their life, and do they want to get better or not. So that's me.
Absolutely. Absolutely. That was a lovely story. Thank you for sharing that with us. And it's amazing to see the way that you are now showing your work through your stories, through your videos, and also, conveying the same to your patients. I can't wait to dive deep into our episode today. And, to begin with, as you've worked as an emergency medicine specialist for so many years, what are the cases that you've seen people come in, and, what makes us end up in the emergency room? I mean, of course, apart from accidents and, mishaps like that, are there some
Yeah.
lifestyle induced cases that you very often see and are very preventable if we are more careful about it?
Yeah, absolutely. I mean, we have a lot of patients who come in with heart attacks or myocardial infarctions, as we call them. Then we have a lot of patients with strokes. So we give this blood clot breaking medication, and we do it for about 100 patients a year. So, and these are the ones who reach us on time, right? There are a lot of people
Right.
who don't reach us on time, where we cannot give that medication. So we have like about 300 to 400 stroke patients coming in minimum a year. A lot of heart attacks coming in. A lot of diabetic ketoacidosis. Patients who become diabetic, they're on medications, and
Right.
then they don't take the medications properly. Their sugars go out of the charts, and they come in with complications. So these are all lifestyle induced diseases and syndromes that patients land up with. So the thing is, and a lot of them that we found out, especially the heart attack patients, they didn't have anything from before.
Mm.
Just a few days back, we had a 48-year-old come in, and people are a little shocked. But we've actually had 17-year-olds also come in with heart attacks. And when you ask them what the diet is, it's full of junk food. It's full of soya chops. No offense to the vegetarians who love their soyas, but yeah, that's something that you should stay away from. Yeah, and a lot of rice, a lot of breads, a lot of rotis, a lot of vegetables, a lot of fruits. So it's all carbohydrate. Obviously, junk food is there. That's going to be a confounder. But if you look at the older age group, also 55, 60, 65 years olds, they don't eat too much of junk food, but they still have a lot of carbohydrates. So heart attacks, strokes, diabetic
Right.
ketoacidosis, three conditions that we see very, very regularly in our emergency departments.
Right, of course. And I mean, the aftercare also needs to improve so much, right? Like, I mean, very rarely, even, I mean, the doctor would come up and they would check your vitals and they do all of those things. And then you have a nutritionist come in a dietitian who would come and consult with you, talk about how your lifestyle is or what do you eat, what you don't eat. And very rarely would we ever see even this coming from a dietitian to, they would, very rarely talk about having meat after this. And in fact, it would be a big
Yeah.
scare to, after having a heart disease, to go on and have meat or anything else like that in your aftercare, right? So it's a very foreign concept, and there's so much awareness that we need to have around it. So thank you for sharing. That was very insightful. And talking about metabolic health, what does it mean for you to properly take care of your metabolic health? What is it that you have changed in your own lifestyle, and what do you advise to your patients to do?
Right. So one point that you said really correctly was about the dietitians. I don't blame them, but thing is that their science still talks a lot about calorie intake and calorie outs. Which is not what our body is built for. They would chart up a nutrition chart for a patient depending on the calories that they need, and then that would be again fully laden with carbohydrates, a lot of them. And in my department, we've actually banned any sugars coming in. If anybody wants to have a coffee, we know that the barista guy is not going to get any sachets of sugar, even if it's ordered by a patient, the patient's attendant, any of the staff, doctors, anyone knows that that'll be probably his last day in my department. He gets
That's
if he gets
amazing.
sugar. And even the F&B department, they're not giving any juices to my patients in the emergency. They might ask for it upstairs in the wards or in the ICUs or something. The patients might get it, but not in my department. No sugary drinks, no cold drinks, no apple juices, no orange juices,
I
none of
mean,
that.
that's such a surprise because I would tell you literally like 2 years back, I was myself in the hospital and I had an accident, right? And I had a surgery and I was there at
Right.
bed for 2 days. And I was actually served like tea, coffee with sugar sachets on it and with all of these things. And if my dad would go to the canteen, there were just not no good meal options even for the visitors. There's just like samosas, sandwiches, and all these sugary drinks. I mean, that is such a surprise that you have made this change and that this is happening, because in any hospital that you go to, this is the scenario, and a lot of us have been through it, right?
Yeah. So, I mean, one has to start somewhere, right? And we've got to start small. India is a number game. We've got the biggest population on earth, and it's going to be really, really difficult to get through to each other, and that's why we're all doing podcasts, making our Instagram profiles public, trying to put out as many messages as possible. And it's not like we're just talking about our own opinions, right? We've actually done our research, we've actually looked into things, we've actually looked into myths, and that's the information there that we're giving out. And you spoke about how heart attack patients stay away from meats. The one of the biggest myths is that cholesterol is an issue, right? It's actually not. Our body is made of cholesterol. Our body is made of fats. Our brain is 60% fat. Our myelin sheets surrounding our nerves is made of fat. Our cell membranes are made of lipids, which is again fats. Our body makes 80% cholesterol anyways, right? And even in 2019, the American Heart Association has come out and said that cholesterol is no more a dietary nutrient of concern. And we all know in the 1960s, the sugar industry paid off some Harvard scientists to actually vilify saturated fats for creating heart disease, when it was actually the sugars and the carbohydrates which was the culprit. And I'm not just saying this from the top of my head. It's been published in JAMA in 2016, and there are a lot of papers which have actually come out and said that cholesterol is not an issue. It's a triglyceride to HDL ratio, which is the one that is concerning. So if cardiac patients want to actually look into the lipid profiles, they should look at the triglycerides and their HDL levels. The triglyceride should be as low as possible. The HDL should be as high as possible. And the only way to do that is to have your red meats and not have any sugars. So if you have sugars and carbohydrates, your TGs are going to go up. People have this notion regarding a low density lipoproteins being the bad cholesterol. It's actually not. There are a lot of papers which have been published where it's actually been shown to be inversely proportional to all-cause mortality, to cardiac disease, to strokes, all of that. So, and then you have to look at metabolic health as a whole, like you mentioned, right? So for me, inflammation in the body is what is going to cause metabolic dysfunction, and the biggest sources of inflammation are sugars and refined oils. These two are the biggest ones, right? Refined oils have polyunsaturated fatty acids, linoleic acid, which actually disrupts your autophagy and causes a lot of mitochondrial dysfunction and causes a lot of inflammation, and that inflammation is going to then oxidize your LDL, and that is what causes plaques, right? Same thing with sugars and carbohydrates. There are 8 different processes in the body, right? You have something called glycation, where your sugar caramelizes, right? So you have cataracts, which is a process of glycation. You have wrinkles, which is a process of glycation. And when you age, these things are going to happen, but then you don't want something that's going to happen at 90 to happen at 50, 55, 60, right? So sugars increase the glycation process multifolds, right? Then you have mitochondrial dysfunction. They screw around with your epigenetics, right? Your epigenetics has changed. They cause inflammation. They cause a lot of oxidative stress. So they actually hamper a lot of processes in your body. And obviously you have your insulin resistance that develops because of carbohydrates, right? You take a carbohydrate, you get a sugar spike, you get an insulin spike, and you develop prediabetes and diabetes. And India, actually, there was a paper which was published. 1 in 3 adults has a metabolic syndrome. That's 30% of the population. And the rest, probably I would say another 40% has pre-diabetes, but they don't get themselves tested till something happens. And then you end up saying, something happens in somebody's family, and they're like, this guy was so fit, or this guy was so young. What happened? Junk food happened. Metabolic syndromes happened, which you did not check out for. I was lucky that I checked my triglycerides in 2021. My triglyceride to HDL ratio was 16. Now it's 1.6. 16 was, I could have died anytime, just like that. But now it's that's 1.6. It should be less than 2, right? And I get
Right.
myself tested every 6 months.
Right.
So it's
Understood.
not just important to have physical health. If you have good physical health and metabolic health, you will definitely have good mental health also, for sure.
Absolutely. No, and talking about cholesterol, there's just so much misinformation over the decades. And I mean, now we have people who are becoming more aware of it. But still, in fact, even in the medical schools, it's still the same thing that we've been taught, right? I mean, the other day that I just posted a picture of having mutton, right? And a doctor friend of mine
Yeah.
messaged me that, why are you posting this? Why are you having this? Like, you shouldn't, because it has more demerits than merits. It has more fat. You shouldn't consume this. And it's very surprising to see this coming from doctors, right? And from a young doctor, like from who's just passed out from medical school right now, who's started to work right now, right? And I mean, we know that since like 10, 20 years back, this has been taught, but it's still continuing the same way. So it gets very confusing for people whom to listen to and whom not to, when the doctor is telling them one thing and they're listening to something else from their trainer or some influencers
Yeah.
from what carnivore nutrition, right? So it becomes very confusing. And talking about carnivore, so it is still a very new concept in India, and not a lot of us have gotten around it, right? And talking about red meat consumption specifically, so, what are your takes on someone who probably doesn't have that much time to work out, who works out only like say 2 or 3 times a week, which is not a very intense workout? They might just go for a run or something like that. But what they have in control is their nutrition. Maybe they
Yeah.
can follow through carnivore nutrition. What is your take on them consuming then red meat, where their physical exertion is not that much? Like they might not even work out every single day, just 2 days a week or 3 days a week. What is your take on that? Because we a lot of doctors or maybe even Ayurvedic practitioners talk about, yes, you can consume meat, because this has been a debate, right? Like Ayurveda says no to meat, or if you're a like Indian, it's a religious thing. But in fact, we also had a Ayurvedic doctor on the podcast who talked about how Ayurveda was never against meat, but if
Hmm.
you are consuming it, make sure that you also have that physical activity happening to balance it out. What are your thoughts on that? If someone is not that physically active but has his or her diet in control and can opt for carnivore nutrition very well, should they or should they not have a red meat consumption?
Yeah, of course they should. I mean, it's all about nutrition, right? One thing, you cannot out exercise a bad diet, and that is what I was trying to do, right? I mean, you haven't seen my before pictures. If you see them, you'll understand what I'm talking about, right? So, carnivore or red meats, first, they were wrongly vilified. The researchers that came out regarding red meat causing cancer and all that shit, it was basically about junk food, right? People were having burgers, people were having pizzas. So nobody took into consideration the sugars and the carbohydrates that they were eating, right? And they were all processed meats, like nitrates. And they have a lot of nitrates and preservatives. As a carnivore diet advocate, I'm not advocating any processed foods, be it vegetarian or non-vegetarian, right? So your red meats are going to give you a whole lot of proteins, a lot of fats, and these are all bioavailable, right? And you'll have a lot of vitamin B12, you'll have heme iron, right? You need heme iron for your hemoglobin. You're not going to get hemoglobin through non-heme iron, which you find in spinach and a little bit of soya and all of that. So those are non-heme irons. You'll get a lot of heme iron from your red meats, vitamin B12, yeah, again, your proteins, and those are essential amino acids. So that's another misconception people have. They talk about proteins. One needs to know that protein has amino acids which are essential and non-essential. The essential are the ones that your body does not make. And red meats and seafood, your eggs, have a whole lot of essential amino acids, and these are 80 to 100% bioavailable and biodigestible, means you actually absorb all of them, right? Don't worry about the cholesterol levels, and even if you're not working out, it's not a problem. See, you need to exercise for lean muscles. You need that when you grow old. Your lean muscle is the one that's going to take care of your bones and your body as such, so your whole skeletal system is going to be stable, and you'll be standing upright even at the age of 70 or 75 or 80, rather than just stooping down or be on a wheelchair or break your bones at the slightest trauma. So even if you're working out 2 to 3 times a week, definitely go for your red meats. That's not an issue at all. Go for it. I mean, and there are a lot of other nutrients also in red meats, right? You have coenzyme qa, you have taurine, you have choline, a lot of stuff. So I mean, anybody can just do their research and find out what all is there, and it's all there. The research is there. I mean, yesterday I was reading a paper in a journal called Nutrients. So it's a very pro-vegan vegetarian journal, and but the paper was about the anabolic effects of plant proteins versus animal proteins, and it very clearly said that plant proteins are inferior to animal proteins in terms of essential amino acids, the bioavailability, the biodigestibility. But since the world is moving towards veganism and vegetarianism, and it's supposed to be healthy and more environment friendly and all that, plant proteins can be fortified, or you can have much more of the amount that it's supposed to eat. What kind of an advice is that? So if you're going to fortify plant proteins, that's all chemicals again.
True.
So you're advocating chemicals to be added to plant proteins for you to get some extra proteins, or you eat another probably 300, 400, 500 calories of plants to give you those 20 grams of protein that you're going to get from like 100 gram of soya, or I don't know, quinoa and all that.
Right.
You need, I think for 20 grams of some amount of non-essential amino acids, you need to have about 3.5 cups of quinoa. Who does that?
True.
So people need to know how much proteins you need. You need 1 gram per kg per day. If
Right.
you have a sedentary lifestyle and if you work out, it just doubles. You need that. You're not going to get it from plant proteins. No ways.
Of
But
course.
you'll end up having 3 times the amount of carbohydrates for sure.
True.
So
No,
anybody
right.
who works out, even if they work out once a week, go for the carnivore diet. It's not a problem. Have your red meats. No issues.
Right. That makes so much sense. And no, these are the two very common misconceptions or myths about red meat. Is one is that if we stay in a much warmer climate, like if you're not in the north, like wherever we are, it's not that cold right now. Is it okay to consume it or
Yeah.
not? And the second thing being that we just discussed is that if I don't work out, do I still need it? Do I still have to have it? Right. So these are the two really important ones. And I mean, I was just in Manali in December, and our Airbnb host was just talking about how his ancestors used to, dry meat and store them, and that's how they used to
So
have it.
then,
And that practice has just
yeah.
gone. And then that question arises that, I mean, of course, they would have to do it because they stay in such colder weathers. What are your thoughts on that? For us who are not living in such colder places, is it okay for us to have it? Because a lot of Indians have this thing that, foreigners are having it. They are doing carnivore nutrition because it's way colder over there and they need that. But do we need it? Is it, are we digesting it enough? Is it going to cause us some gut irritation if we're having it in a very hot weather?
It doesn't cause any gut irritation. It's all digested in the small intestine, anyways, right? And red meats are not pro-inflammatory. They're actually anti-inflammatory. They really help you. It's the roughage which causes gut inflammation. If you look at patients of irritable bowel syndromes and inflammatory bowel diseases, they're actually told to stay away from roughage. They need FODMAP, so they need foods which are going to get fermented. So they're usually given a bit of sugars and even meats which are going to help them. Red meats are not going to cause any gastric issues. I mean, I don't know of any carnivore who's ever said that meats are causing them any gastric issues. A lot of people have this misconception that it causes constipation. Let me tell you, constipation is when you have waste products and it doesn't come out. You don't get waste products when you're having a carnivore diet because it's all getting digested and absorbed by your body. So that is not constipation. I have no issues going to the washrooms every morning or maybe once in 2 days. It's not an issue at all, right? And people have this misconception that fibers are good as a laxative, and so if they're good as a laxative, how can they be a nutrient? First, they're not, right? Secondly, if you look at infants and babies, they drink milk, mother's milk, which is all full of fats, and they poop probably 20 times a day without eating any fibers or roughage. And when you have babies or even adults, when they're constipated, they're given suppositories or enemas, which are again fats. We don't push in roughage or fibers. They're constipations. It's fats.
True.
So you actually don't need fibers, right? And like I said, humans, our intestines are way smaller than the herbivores. You have cows, you have buffaloes, you have sheep, lamb, all of them. They're all ruminants. Their intestines, their digestive tracts are probably 1,000 times longer than ours, and they have a 24/7, 365 digestive process. They keep digesting cellulose. If they're being regeneratively grown and taken care of, they're eating grass that we can't. A lot of people have this, again, a lot of vegetarians will talk about animals eating vegetarian food and being so strong. They're not eating vegetarian food, they're actually eating grasses and converting that cellulose into meats. And they have fermentative bacteria in their intestines, which is breaking down those cellulose and converting that into proteins. So we can't do that. We don't eat grasses. We cannot.
True.
We'll die. If you go to a jungle and you find an unidentified plant, I don't think you're going to taste that.
True.
Could be poison. But if you see an animal and if you're hungry, you will definitely hunt it and eat it.
Absolutely. Right. That makes so much sense. And I'm sure that people can definitely try this out as an experiment, because me also in the beginning, I just experienced so much of a difference just with 2 days. Like one day of eating however I was eating, like vegetables and having roti and rice, and more on the veggies still and less on the carbs at that time.
Yeah,
I mean, on like roti and rice, right? And the
protein.
second day, I just, I didn't consume any red meat, but I did have chicken, I had fish, I had eggs, and there was just so much of a difference in just these 2 days of how I felt and in my digestion, right? I mean, this is a great experiment to just, I mean, try it out for yourself, because your body won't lie to you and you will experience that for yourself, right? So thank you for sharing that
Yeah,
with
yeah,
us.
absolutely. I mean, I've been talking to a few of my psychiatry friends, and I told them that it should actually be put into the psychiatric manual. We have a diagnostic manual. It should actually be put into that, and there should be some kind of a therapy for carbohydrate addictions. Because I mean, if I tell somebody stop your sugars, they're like, "What? You want me to stop cakes, chocolates, biscuits?" I'm like, "Yeah,
Right.
I can't do it. They're
We also
addicted.
talk about
Can't."
eating disorders. It's usually about, being undernourished and not being able
Yeah.
to eat things, but it's never the other way around, like talking about how addicted we are to carbs. It's just a normal day, it's a normal thing that almost everybody has in their life.
Yeah, they've done these. They've done experiments on rats where they fed them sugars. There was a group of rats who had sugars. There was a group of rats that had cocaine, and it was easier to get the rats off the cocaine than off the sugars.
True.
So sugars are even more addictive than cocaine. And if you look at fatty livers, a lot of people have alcohol. There are very few people who have alcohol every day. The ones
Right.
who drink every day obviously will end up with alcoholic liver disease. But there are probably 10 times more people who eat sugars
Non-alcoholic.
every day and end up with non-alcoholic fatty liver disease.
Right.
Last year in one of the hospitals in Bombay itself, there were 100 transplants, and one of my friends told me over there that out of those 100 patients, 65 had non-alcoholic fatty liver disease.
True.
That's because
And
of their carbohydrate intake.
right, and correct me if I'm wrong, but I recently read this in a book somewhere about, because you mentioned sugar and cocaine, that in an experiment they found out that it actually triggers the same part of the brain where any of
Yeah,
these two things, whenever you're coming in contact or using it, and that's very surprising. And
absolutely.
still we are in this same cycle, and we feel like it's normal, it's okay, I'll just have that one more pastry, I'll just have that one tea with sugar, it's fine. And also, people are talking about this daily consumption of sugar, right? Like, I mean, you are allowed to have this much sugar. There are so many, famous nutritionists and dietitians who are talking about, it's okay, don't quit that sugar from your chai. Like, it's okay because this is your daily allowance and you can still have it, which is such a harmful thing to say in a country where there are so many diabetic patients, and you're telling them that, okay,
Right.
yes, go ahead, go have that one cup of tea with sugar. There's no harm in it because you're allowed to have that.
It's wrong. It's feeding their addiction, and it's normalizing junk food and sugars, which is absolutely incorrect. That should not be. I find it unethical now. I
Right.
mean, since I've done my research and everything, and I've realized that even I used to say something like that. Okay, fine, you can have probably a spoon a day or whatever, right? Or you can have good, or you can have brown sugar or something else. But
Hmm.
they're all the same actually, right?
True.
The body does not know if you're having a refined sugar or an unprocessed good. It's still going to undergo the carbohydrate cycles in our body, starting from the tongue itself. And you're going to have the sugar spikes and the insulin spikes. Look at cancers, cancer cells, it's been shown that they feed off sugars. They
Right.
don't need oxygen, they need sugars to ferment in the body. And that
Hmm.
is what they thrive on. If you look at the PET scans which are done, the dyes which are given for the PET scan has glucose in them. So when they do the scan, they see which parts of the body are actually firing up
Right.
in reaction to the glucose. So which are the cells which are eating up that glucose really, really fast. That's how they see where the cancer cells are.
Wow.
So why do you want to get cancer? Forget about diabetes. Okay, fine. I can live with diabetes. I can live with the heart disease. Okay. Do you really want to live with cancer? The test itself is feeding sugars to the cancer cells to diagnose it for you. And then there are studies, and there are a lot of doctors who actually had cancers in the US and Australia and all, who went off all carbohydrates, went completely carnivore,
Right.
and the tumors disappeared. Absolutely disappeared. Zero. And they've maintained that. Means
Right.
what? Carnivore diets can actually help you heal. A lot of pre-diabetes, a lot of diabetes, a lot of heart disease, a lot of autoimmune disorders have completely reversed in people. And there are thousands
Absolutely.
and thousands of people who've come out with their stories. You don't hear any carnivore saying, "Oh, carnivore really was playing around with my health. I was not feeling good, and so I turned to vegan or
Right. True.
vegetarian, and it's better." You actually hear the other way around. You hear a lot of vegans and vegetarians say, "Oh, I was suffering from this. I wasn't getting any nutrition." I mean, vegans don't get any nutrition anyways, right? And then they converted onto a carnivore and they're doing much, much better. Why is it just a one way story? Why is it not the other way around?
Right.
Because humans were always supposed to be carnivores.
Of
And we
course.
lost that knowledge somewhere over the years.
Absolutely. That makes so much sense, and I'm sure that if you were given the superpower, you would have all your patients go carnivore. But this can be quite a shock for a lot of people when you tell them that you have to do this. They're like, no ways, because it just shakes their belief system up from what they've been doing for decades, right? But if not
Yeah,
carnivore, what are your non-negotiables for your patients? Like, this is just something that you cannot continue doing. If you can't go completely carnivore, what are some things that you should definitely begin with, and as preventive health?
at
Right.
least eggs, at least 4 to 5 eggs a day. That'll also give you like about 20-25 grams of protein and 20-25 grams of fats, which is still not sufficient enough. But start off with that at least. Do your chicken soups, maybe broths, all of that. Obviously, cut
Right.
down your carbohydrate intake as much as possible. That's a non-negotiable. But more than my patients, it's really important for us to actually convert a lot of doctors, because one doctor comes in touch with at least 50,000, 100,000 patients in their lifetime.
Right.
And so I mean, I have colleagues telling me that your LDL is so high, it's not good for you. I'm like, yeah, come on. I mean, that's old story when I used to think the same. And then they go around quoting the CDC website, and I'm like, yeah, I mean, one needs to know where that information is coming from and who are the sponsors of the websites. So
Right.
yeah, and obviously they've not been updated, but they would still say no till an authority website doesn't say that LDL is okay for you. I'm not going to believe it. I'm like, okay, fine. I mean, that's up to you. You can do your own research. And he's like, yeah, but anybody can publish anything. That's true. Anybody can. So that's why you're doctors, and that's why you need to read through the research and find out which paper is actually good and which paper is actually trash. And
Right.
then whatever you want to take out of it, and take your lifestyle ahead. So it's very important to change doctors. A lot of doctors are vegetarians. A lot of them. I was quite surprised when I started asking around my hospital. A lot of them are vegetarians, and and they have issues. They do have issues. It's not
Right.
that they're all fit and fine. They might look fit and fine, thin, scrawly, but they have their own issues. But again, they've been vegetarians for religious reasons, and it's very difficult to change them. So I mean, once they do change themselves and they find differences in what's happening to their body, then only will they be convinced enough to further that knowledge to their patients.
Right, of course, and I mean, a lot of times you need to understand that your doctor is also somewhere or the other working from their own belief system, whether it's religious, whether it's what they've been having in their family for a very long time, and for someone to change that after 4 or 5 decades is very difficult, and unknowingly that gets passed on through the advice you give your patients, or whatever that you're planning out for your patients, right? I mean, recently my parents went to this doctor, and in two scenarios, like, so one was for diabetes, and they got this diet chart, and it was completely opposite and outdated from whatever we have been talking about with so many guests, so many doctors, and trying to educate about, right? I mean, it was like, have 6 meals a day, and have everything in limitation. It was
I've done
literally
that. I've done that. I've done that.
exactly. It was, and for someone with a metabolic health disorder, you're telling them to have 6 meals a day, and to have everything you want, but in limitation, and that is still happening. That mindset is still there. And also, like, my father recently went through a surgery which was around gut health, and he was told not to have any meats at all, like, to stay away from it, and for the next many ever months for the aftercare,
Yeah.
right? And so that's true. We definitely need to have this a good bond with our doctor as well, where we do counter question them. We don't blindly believe just because it's prescribed to us, right? So we should definitely
Yeah.
have that conversation and not just take the prescription and go home.
Yeah, yeah, absolutely, yeah. And people need to understand that it's not just about the medicines, it's about what you're putting in your body. It's the food that you're putting in, the nutrition that you're giving your body. That's as important. I think it's more important than the medicines. You won't need half the medicines.
Absolutely.
I got off
Amazing.
my
That
antihypertensives, I got off my statins in 6 months.
Wow, amazing. That was a very insightful conversation. Thank you for sharing all these insights with us. I mean, some of these things even I just heard for the first time, especially when you talked about the cancer tests and how cancer feeds on sugar, right? I mean, that's amazing. Thank you for sharing that with us. And this brings us to the end of the episode today. As we conclude, do you have any last messages or thoughts to leave us with?
Yeah, thank you so much for having me on the Settle or Be Better podcast. Actually, I mean, it's been a pleasure talking to you. For the people out there, I mean, get control of your health, get yourself checked. There are a few parameters. You can always get in touch with me. I think you can share my Instagram handle
Absolutely.
where they can get in touch with me. I will tell them what are the metabolic profiles that you need to get done. Even if it's normal, that doesn't mean that you go feeding on your sugars and carbohydrates, because it'll just take a year or two to, completely change your metabolic profile. But yeah, stay physically healthy, stay mentally healthy, stay metabolically healthy, and go carnivore.
Absolutely. That's an amazing message. Thank you for sharing that with us. And for the ones who don't follow you already, there'll be links in the description below. They can reach out to you, learn a lot more from you, and watch your carnivore journey more closely. So thank you so much, Dr.
Thank you so much.
Ankur, for being here today and for your time. It was an amazing and insightful episode.
Thank you, Sakshi. Pleasure.